Good morning, everyone. I think we'll go ahead and get started. Feel free to wander and get coffee and breakfast and register. My name is Seddon Savage. I'm the director of the Dartmouth Center on Addiction Recovery and Education. And on behalf of our tiny staff and Board of Executive Committee, I am pleased to welcome you here. This is the 10th annual Dartmouth Symposium on Substance Use, this year focusing on emerging technologies to advance prevention and treatment of substance disorders. DCARE is a small center at Dartmouth that is devoted to education and to advocacy. We try to bring people together from across the Dartmouth system, from the medical school, the college, engineering and other schools, and from the community, different sectors of the community, to really cross-fertilize ideas and share perspectives on the ubiquitous challenges of substances and addiction in society. To that end, we host a program for students that is to nurture the C. Everett Koop Scholars in Addiction Studies program, which takes students at the college, at the medical school, any of the Dartmouth schools, and really nurtures leadership and a kernel of interest in this field. We meet on a regular basis. We have university seminars that bring together faculty and also with the Koop Scholars. We have faculty presentations and community presentations. We meet over dinner on a monthly basis, again, to cross-fertilize and share ideas. I mention these, I'd just like to say that if anyone has an initiative or research or a clinical program that they'd like to present, we're always looking for speakers who can whet our interest in new areas and help us network with new ideas. And similarly with the Koop Scholars, many of them are looking for mentors and places they can go to learn different approaches to the field. So any of you are interested in serving either as a mentor or doing presentation, we'd love to hear from you. We also have a monthly newsletter. We have, near monthly, I should say, I think we skipped this month preparing for the symposium, and website, with the purpose of sharing resources. We host 2 symposiums in the fall every year. In the fall, we try and focus on topics of interest to general healthcare, to really work towards engaging the general healthcare system in identification, treatment, and intervention in substance use disorders. I think we all know that there's a crying need for that, and we have real opportunities now in the transition of our healthcare system. And at the state level, it is a high priority. So I think we're targeting this fall looking at the science of mind-body interventions for addictions and how to integrate those into care of patients in different settings. In the spring, we try to be a little edgy. We either have a very controversial topic. We've had tobacco harm reduction, is that an oxymoron? We've talked about lowering the drinking age. We've talked about marijuana as a therapeutic substance. This year we're being edgy and trying to be very cutting edge and looking at technology. And we are really honored and pleased to be co-sponsoring this with the Center for Technology and Behavioral Health, which is a larger and very prominent center at Dartmouth that I think is leading really cutting-edge interventions to try and expand capacity to treat, to identify, prevent, and treat substance problems. So the day is devoted to that. The Center for Technology and Behavioral Health, you may hear more about from Lisa Marsh, who will be our first speaker, and she's director of that center. My understanding is that from reading a little about it and talking to Lisa, is it really brings together interdisciplinary teams of people with different perspectives, from behavioral health sciences to technology to treatment, health economics, ethics, regulation, public policy, in a goal of really bringing together existing and emerging technologies to develop and deliver evidence-based interventions for substance use and co-occurring disorders. So we're excited to have many of the faculty from that center here with us today, and visiting guests from Yale, who I think have interfaced with the center as well. I don't think we could have better partners for today's symposium, and thank you very much, all of you, for working with us on this. Before I introduce our morning moderator, who is Bob Drake, who many of you already know, I'm sure. A little housekeeping. CEUs and CMEs are offered for this. I believe, and I will double check and confirm later, that if you're getting CEUs as addiction professionals, there should be paperwork in your packet for that. The CME seems to be done online, and there should be information on that as well. On breaks and over lunch, I think we're going to have an opportunity to try out some of the technologies that our speakers will be talking about. They may share some web addresses, URLs, or actual hardware, though I actually haven't seen that. So, but hopefully over lunch and breaks we'll be able to do some of that. And then we'll have lunch here. If it becomes a beautiful day, feel free to take it outside. Otherwise, we can hang out in here. It's a lovely space. This is a student center, and hopefully we'll have some students coming in and sharing some of their time with us. So we'll make them feel welcome, should they come.